Talking about PDO thread lifts, it's an aesthetic technique that uses surgical threads to tighten the sagging skin and reverse the signs of age. We can use the PDO thread lift under the eyes. We insert some surgical fine threads under the eye. It will give some support to the skin underneath the eye and improves the color, texture, and it gives an anti-wrinkle treatment as well. It has collagen, so it releases collagen to the skin to improve the texture, and it works better after 3 months. It's a very safe treatment. There are any contraindications known for it. Thread lift is used for certain areas in the body that other treatments are not good for, like under the eyes, the jowls, the neck. You can use it on your body, but it can be a bit costly. Well, our treatments usually very reasonable. It starts from £500 onward, depending on how many surgical threads we need to insert. Depending on the area of the body, it starts from any 18 months to 3 years. For an example, under the eye, it stays longer and stays like around 3 years. But in the lower face and the jowls, it can stay up to 2 years. It started around 4 years ago, and it's a very good and safe technique. We use fine, small threads to support the face. PDO thread lift takes anything from half an hour to an hour, depending on the area of the face we are treating. Usually, you are not supposed to wear makeup for the next 48 hours. You might experience some bruising. We usually apply Emla cream, which is an anesthesia for the face, for 15 to 20 minutes to numb the area. It's tiny discomfort, if any. There are so many types of fillers in the market. They are usually made of hyaluronic acid, which is a fruit acid, or more advanced technology that can improve your collagen production, depending on the type of it. The fillers vary from one to the other. Some fillers last 6 months, some 1 year, some 3 years. Depending on the kind of fillers, some fillers actually are very good for the skin, and they prevent signs of aging, and they improve the collagen production of the skin. Well, when you do it once, then you find out if you like it. If you want to do it again, it's fine, it's even better. It delays signs of aging. But if you don't want to do it, your skin will stay as it was before. It's not actually side effects. You might have some minimal bruising because we are using needles, but as side effects, some people feel too much the face, then that's the personal choice. Usually fillers are almost painless because it's mixed with local anesthetic that will numb the area and you won't feel a bit. Most areas of the face you can use, usually cheeks or jowls or lips are the most common areas. My personal favorite brand is called Radiesse. It's an American company which has been going in the market for a long time. I've been using it for 9 years. Usually it lasts anything up to 18 months, a year to an 18 month, and it's a fantastic filler, and it's a collagen stimulator. Of course, you can use Botox, fillers, mesotherapy, plasma, even threads at the same day. It's called the combined therapy, and it's a very good thing to do at the same time. It's really difficult to tell from what age, but some people who've lost a lot of weight and they lose a lot of volume in the face, they need fillers, no matter how old they were. Maybe a very severe diet on an early age can lead to the need of using fillers from 18 even. Or some races and skins are different. They sag more and the signs of age shows more on them, and then we need to use fillers. For lips, the only type of filler we can use is hyaluronic acid based, because it can be reabsorbed by the skin, and it sits nicely on the lips and gives a nice volume. Not really, you don't have to redo fillers all the time, but once you get used to certain look with a fuller lips, you want it all the time. That's the thing. And the other very good thing about the lip fillers, that if it gets overfilled or anything, we have a certain products to dissolve it if it's uneven or anything. With the filler, the effect is immediate. Once we inject the person, you can see the difference immediately, but it calms down a bit because you might have some swelling because of needle usage. My best advice for people who are losing the hair, or it's getting thinner, or it's falling a lot, to use the PRP treatment, which is plasma based. We take some sample of blood and we purify it. We separate the plasma cells and we activate it with some calcium, and we can sometimes use mesotherapy with it, and we re-inject it in the scalp. It really improves the hair growth. It stimulates the follicles and make the hair growth better. For hair loss, we really need to have a few sessions, anything from 3 to 4 up to 6 sessions, because we need to do it monthly to stimulate the hair follicles, and we will see results after 6 months. PRP doesn't usually work with alopecia or complete baldness, but otherwise it's very effective. Certainly, hair transplant is one of the very important indications for PRP, because it usually revitalizes the hair follicles that are transplanted and makes it better and makes it more strong.